You've just been diagnosed with squamous cell carcinoma, or SCC. And if this is your first skin cancer, yes, you might feel unsure and worried. That's totally normal. It can feel overwhelming at first, and you may not be sure what this means or what comes next. In this video, I will explain exactly what an SCC is, how it's different from other skin cancers, including melanoma, what likely caused it, how we treat it, and what you should expect going forward. All in clear, simple language with no jargon and no drama. This is not melanoma. First, it is important to know that an SCC is not a melanoma. SCC is a different type of skin cancer. It comes from the surface layer of the skin, and it does not turn into a melanoma. But unlike BCC, the most common skin cancer, SCC is more serious because it has greater chance of growing deeper or spreading if not treated properly. How common is it? SCC is the second most common skin cancer in Australia after BCC. It makes up about 20 to 30% of all skin cancers we diagnose and treat. We see it every day, and we manage it routinely. What caused this? The most common cause is long-term sun exposure, especially from younger years. SCC usually appear in sun-exposed areas, the face, ears, scalp, lips, hands, and lower legs. Can it spread? Yes. Unlike BCC, SCC can spread in some cases. It may grow deeper. It may grow into deeper layers of skin, and occasionally it can spread to nearby lymph nodes or glands. That's why SCC must be taken seriously and treated properly, even though it's still considered one of the more curable types of skin cancer when caught early. What's the treatment? Most SCCs are removed with simple surgery, cutting it out with a small margin of healthy skin. This is usually done in the clinic under local anesthetic. If the cancer is larger or in a difficult area, you may be referred for specialist care. If completely removed, it rarely comes back in the same spot. But once you've had an SCC, your risk of developing another one somewhere else does go up, so ongoing skin checks are really important. Some other common questions. How long has it been there? It's hard to say. SCCs grow faster than BCCs, but they can still sit there quietly for a few months before showing obvious signs. Why didn't I notice it earlier? SCCs can look like a crusty spot, a scab that doesn't heal, or a thick red patch. They don't always hurt, so they are easy to overlook. Can I still go out in the sun? Yes, but with greater care. Use SPF 50 sunscreen every day, wear a hat, sunglasses, and cover up your skin, especially if you'll be outdoors for long. Is it a melanoma? Will it become melanoma? No, SCC is not melanoma and it doesn't turn into melanoma. But it's still serious and needs proper treatment to prevent complications. In summary, being diagnosed with any skin cancer can be stressful, but SCC is very treatable when found early. It's not a melanoma, but it's not harmless either. SCC can spread, so we treat it promptly, remove it properly, and follow up with regular checks. With the right care, most people do very well after an SCC diagnosis. And if you'd like to see what SCCs can actually look like, I've added some trusted links in the video description below. These show real clinical images from reputable medical sources, and they've all been carefully vetted. And if you found this helpful, or know someone who has just been diagnosed with skin cancer, consider sharing this video with them. You never know who might need clear, calm guidance at a time like this. You can also subscribe if you like more straightforward, no-nonsense advice on skin health, skin cancer, Straight from an Australian skin doctor who sees this every day. I'm Dr. Chris Ho. Thanks for watching, and I'll see you next time.